Mental illness affects around 45% of Australians at some time in their lives, but it is treatable. Approximately 1% are affected by schizophrenia.
What is schizophrenia?
Schizophrenia is a medical condition which affects the normal functioning of the brain. It interferes with the person's ability to think, act and feel. Schizophrenia is relatively common, affecting around 1 in every 100 people at some time in their lives. Most of these will be affected first as young people in their late teens and early 20s. Males are slightly more at risk than females, and also tend to develop symptoms earlier in life. Some people are probably born with the disposition to develop this kind of illness, and certain things, for example, stress or use of drugs such as cannabis and ecstasy, can trigger a first episode of illness. Some recover completely. For others it is a lifelong condition. With modern medications, other treatments and support, most are able to get back on with their lives. While there is no cure for schizophrenia, with early diagnosis and effective treatment, the outcomes for people with schizophrenia are better than ever before.
People affected by schizophrenia have one personality, just like everyone else. It is a myth and totally untrue that those affected of a so-called split personality. What are the symptoms?
The main symptoms of schizophrenia involve a loss of contact with reality. When acutely ill, disordered thinking is a common symptom of schizophrenia. The everyday thoughts that enable us to lead our lives become confused and don't join up properly. This may lead to difficulties in thinking and communicating clearly. Delusions and false beliefs not shared by other people from the same cultural background, and which are impossible to change by logical argument.
For example, the person may believe that thoughts are being inserted into their mind, that they have special powers or are being spied on. Hallucination involve the person hearing, seeing or otherwise perceiving things which are not actually there.
Other symptoms may include very low motivation, withdrawal from others, difficulty expressing emotions, for example, showing pleasure or sadness inappropriately. Some people are diagnosed with a related condition called schizoaffective disorder. As well as symptoms such as those mentioned, they experience extremes of mood of mania or depression without reason. Schizoaffective disorder is treatable, in a similar way to schizophrenia.
What are the treatments?
Treatment can do much to reduce and even eliminate symptoms. Diagnosis is generally often managed by the person's own GP. Most people with schizophrenia live and are treated in the community, rarely or never going to hospital. The most effective treatment usually involves a combination of medication with other forms of treatment and support, such as psychological therapy, supported accommodation, rehabilitation and education.
Medication.
Medications used to treat schizophrenia are called antipsychotic medications. These help restore the natural chemical balance in the brain, and are not addictive. They may be available in tablet or injectable form. Newer, atypical medications are less likely to cause some of the distressing and often disabling side effects associated with the older antipsychotic medication.
Other treatment and support.
Longer-term treatment and support may be provided by community mental health services, local clinics with specialist mental health workers, by disability support services and by GP. Education, training and support for family and other carers is an important part of treatment, as is understanding from the community.
Where can I get support?
Talk to your GP, local hospital or community mental health service if you are concerned about anyone who is showing signs similar to the symptoms described earlier. Whether you are concerned about yourself or someone else, it will help the doctor if you give as much relevant information as possible. Write down some notes about your concerns beforehand, to take with you and make it easier to discuss them with the doctor. If there is a diagnosis of schizophrenia, it is important to learn the warning signs of relapse so that help can be sought before another episode occurs. This should be discussed with the treating doctor, other key mental health workers, family and other carers. Regular review by the doctor is also important to ensure that the most effective treatment is being provided. If you or someone you know has schizophrenia, it is useful to have a crisis service phone number handy in case of an urgent need for help.
A range of community agencies provide support for people affected by mental illnesses such as schizophrenia. Call the SANE helpline on 1-800-187-263 for details.